As matron for harm-free care, my aspiration is to reduce the harm to our patients from falls and pressure ulcers whilst they're in our care. People's First has given me the support, the framework and the tools to ensure that we are able to drive home change within our ward teams, with our ward teams owning those actions and being empowered to make sure that they can prevent harm to the patients in their own care. A good example of this was an action plan on Braunton, which was initiated by the senior sister and her team there. Through shared governance, they had a conversation around falls, and they established that falls was a problem. Patients were having up to 6 falls per month, and they'd also sustained a couple of serious harm events where patients had a fractured neck of femur. To address this, the ward looked at what was actually causing falls and putting their patients at risk of harm within their own areas, and they established that some of the key themes were lack of supervision or assistance to get to the toilet, some blood pressure changes, and being on high-risk medications. So the ward addressed this. They looked at patient education, and all patients were given a patient information leaflet, and the ward made sure they had a conversation around falls with those patients. They looked at using call don't fall and ensuring that patients knew that they could actually call for help when required, and they would get a response from their ward team. And they discussed on a daily basis through their safety huddles not only falls but pressure ulcers as well. And since then, the ward have managed to achieve no serious harm falls within the last 6 months.